Hi, it's the nursing professor here. So today we're actually going to talk about cardiac medications. Now, this is third of that series of things that you need to know before you take your next exam. So we've talked about cardiac disease, how we want to manage it as it relates to electrolyte imbalances. We've talked about priority, how we handle a disease, like which comes first. So today we're actually going to talk about cardiac medications. So before we get started, I want you to like and share this video because it really does help the channel. All right, so let's get into it. So first on the list are beta blockers. So we know all of those, the way we remember those is typically they end in LOL, laugh out loud, right? And so that's your metoprolol, atenolol, and drugs like that. What we want to make sure that we are aware of is that sometimes that heart rate can be really low. And so it's important that we measure the heart rate while we can take a radial pulse or an apical pulse and make sure that it is at least 60 beats per minute before we actually administer beta blockers. All right. We also want to be careful with beta blockers with a person who has asthma. So keep that in mind. When we talk about respiratory drugs, we'll go into that a little bit deeper. Next on our list are ACE inhibitors. And typically this is one of the first line of drugs that are used in order to manage hypertension. All right, what we want to make sure our patients are aware of is to watch for a cough. Sometimes people get this nagging cough. They can't figure it out. They cough, 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 especially at nighttime. And so they need to make sure that they're reporting that to their provider. It also can increase your potassium. And remember, in the first of this series, we talked about an elevated potassium and all of the dangers that come along with that. One of the other things that happens with ACE inhibitors is that a person could take this for a long, long time, many, many years, and suddenly they will have an allergic response to the drug. They will literally have angioedema where their lips get swollen, their throat starts to close out on them, and it just happens just very suddenly. So we want to make sure that our patients are aware of that. So because ACE inhibitors can sometimes lead to that, then another set of drugs that are used for to control blood pressures are your ARBs, or your angiotensin receptor blockers 1 and 2. All right. And so those will be your drugs that typically end in AN, like losartan. Now, ARBs typically have less side effects than ACE inhibitors. However, ACE inhibitors are frequently prescribed as a first-line drug. Don't ask me all that pathophysiology, but just know that and be aware. And I want you to be able to relate that this is what happens with this set of drugs. All right. So moving on, we talk about nitroglycerin. That's an emergency drug for the most part. Person complains of chest pain, especially if they're at home. We teach them to either take their own nitroglycerin, or when they call for emergency services, then they would start to give them nitroglycerin in order to ease some of that chest pain. Now, what we need to be aware of first is to check their blood pressure, because if their blood pressure is too low, that nitroglycerin is going to really make that blood pressure go down and go down really fast. So we need to know the blood pressure of a person prior to giving nitroglycerin. The other thing is this, is that those are typically sublingual tabs. And so they shouldn't be kept in front of light, like sunlight and things like that. So if we're giving discharge instructions, we want to make sure our patient understands that. Digoxin is a very old drug, but it still is used with patients where other things just don't work. And what it does is it slows the heart rate down such that that person can actually get the force necessary in order for their heart to do what it's supposed to do. Now, with digoxin, we want to take an apical pulse for a full minute, because we want that to be at least 60 beats per minute. If it is under that, we don't give digoxin, because I just told you that it slows the heart rate down. So you can imagine if you're starting at 60, it's going to lower it more than your person can really get themselves into trouble. There's signs of toxicity that does accompany digoxin, and they can be nausea and vomiting, People can actually see yellow. They'll describe it as that they're seeing yellow, or they'll see like blue halos around their eyes. Those are classic signs of digoxin toxicity. And so the way you would know that is go with signs and symptoms. You can get a digoxin level, which is just a blood draw, and you'll be able to see whether or not that person is within the range or not. So if you hear that reported to you, immediately you want to stop and report that. You would never want to continue to give that person more and more digoxin if they're already feeling those or having those symptoms. So I hope that helps. I will see you next video where we're going to talk about respiratory drugs. Have a great day. Bye for now.